This topic is urinary tract infection, cystitis, and pyelonephritis. Urinary tract infection, or UTI, is a bacterial infection of the lower urinary tract, known as cystitis, or an upper urinary tract infection, known as pyelonephritis. UTIs are most commonly caused by the bacteria E. coli, and UTIs are diagnosed via a clean catch midstream urine sample. Urinalysis will show white blood cells due to the presence of inflammation, as well as nitrates due to the presence of bacteria. Risk factors for UTI include being of the female sex. The female anatomy has a much shorter urethra than the male anatomy, which means that bacteria don't have to travel as far to colonize. Additionally, the use of perfumed pads, douching, and spermicide-coated condoms can cause periurethral irritation. Irritated and inflamed tissue creates an environment where bacteria can also colonize more easily. Next is advanced age. Neuromuscular conditions such as Parkinson's disease or stroke are more common in older adults. These conditions can cause incomplete bladder emptying, which can result in urinary stasis. If there's a pool of urine sitting in the bladder, bacteria can definitely colonize pretty easily and travel up the urinary tract. Bladder obstruction is also common in older adults. In men, an enlarged prostate, or in women, the presence of a cystocele or vaginal prolapse can cause incomplete bladder emptying. This again can result in urinary stasis. Diabetes mellitus is another risk factor. Neuropathy from diabetes can also result in incomplete bladder emptying, while glucose in the urine from diabetes creates an environment that is prime for bacterial growth. Sexual intercourse can cause irritated periurethral tissue. This irritated tissue can allow bacteria to enter in more freely. Additionally, bacteria can be passed between partners during intercourse. The recurrent use of antibiotics reduces the body's natural flora and can cause a resistance to antibiotics. The presence of a foreign object, like a kidney stone, can obstruct urine flow and result in urinary stasis, like we talked about earlier. Additionally, the presence of an indwelling urinary catheter also allows an easy entrance point for bacteria. This is why it is super important that we carefully clean indwelling urinary catheters in the hospital, but also that when clients are at home with an indwelling urinary catheter, they're taught about proper cleaning techniques. Clients who have an indwelling urinary catheter at home should also be taught about systemic signs of infection such as fever and local signs of infection such as purulent drainage, redness, swelling, or tenderness. All right, first let's talk about the clinical features of cystitis. So this is going to be the infection of the bladder and below. Dysuria, which is painful or difficult urination, is common, as well as urinary frequency and urgency. Hematuria, which is blood in the urine, is common, as well as the generalized symptom of lower abdominal pain. Pyelonephritis, which occurs when the infection travels up the ureters to the kidneys, can cause more generalized symptoms, such as nausea and vomiting, fever, and flank pain. It's important to note that confusion is a common symptom in older adults of UTI and is often actually the symptom that leads to them being diagnosed with a UTI. An important clinical feature of pyelonephritis is costovertebral angle tenderness, or flank pain, and this pain can radiate on the side. The first component of pharmacological management for a UTI is antibiotics. Antibiotics are going to kill bacteria as well as prevent additional bacteria from colonizing and the infection spreading. For clients with abdominal pain or fever, we can administer antipyretics and analgesics. Lastly, for clients with inflamed bladder tissue and bladder spasms, we can administer antispasmodics. Clients with UTI should be taught to increase their fluid intake to about 2 or 3 liters daily. This is different for every client, so the client would need to talk with their healthcare provider to make sure they pick an appropriate fluid amount. Fluid should be mostly water, and clients should be taught to avoid bladder-irritating foods and beverages, such as caffeine, spicy foods, and alcohol. Perineal hygiene should be emphasized to prevent recurrent or worsening infection. So for females, they should be taught to wipe front to back after defecating or urinating. Males who are uncircumcised should be taught to pull back the foreskin when cleaning. Infants with wet diapers or clothes should be promptly changed. The warm, moist environment of a diaper is a prime breeding ground for bacteria, so getting the infant into something dry will help reduce irritation and prevent infection. Lastly, all clients should be taught to avoid scented soaps and bubble baths because these can cause periurethral irritation. Clients should avoid wearing underwear made of synthetic fabrics such as nylon or spandex because these seal in moisture. Clients should instead be taught to wear cotton underwear only. Clients should be taught to not delay urination. In some cases, they may even need to create a schedule to make sure they're going to the bathroom at frequent intervals. Delayed urination can cause urinary stasis, and like we said earlier, a pool of urine is going to be a breeding ground for bacterial colonization. Lastly, clients should empty the bladder before and after sexual intercourse to flush out bacteria.